And lotus root. Lotus root.
Okay, well, you're in an exotic land.
It's not like you get any of that stuff.
Drive on over
Sure,
to
we are.
exotic Lotus root. Running low on testing. 7-Eleven carries it. Lotus root.
What did he say? Land of what? What did he say?
Okay,
Land of
cardiac
what? Lotus?
stimulator
Something like
drugs.
that.
Already
Say
from the
land of-
title, what sort of diagnosis is going to be on these? Cardiac
Yes.
stimulator. All the rest of these were kind of relaxing the heart, but this one's going to stimulate the heart. So what diagnosis is going to be on this? When does the heart start to poop out?
Doesn't get it.
Heart failure. The only people who are going to be put on cardiac stimulators are those in heart failure. This is a very extreme drug. You will only see patients on this in an inpatient setting. It'll be called digoxin or digitalis. You have to know both of those names. What it does is plays around with norepinephrine. So it blocks the reuptake of norepinephrine. So it's playing around with the sympathetic nervous and parasympathetic nervous system. So it slows the heart rate, increases the force and velocity of cardiac muscle contraction, decreases the AV node conduction velocity, therefore decreasing sympathetic nervous system activation. Okay, so by blocking the reuptake of norepinephrine, it's decreasing the sympathetic nervous system activity, which decreases heart rate and increases the force and velocity of cardiac muscle contraction. So we have increased stroke volume, decreased heart rate, hopefully a more efficient cardiac output. Okay, so it is indicated for heart failure and severe atrial fibrillation. Again, you will only see this administered in an inpatient setting.
So you could have a stimulator or a suppressant for heart failure?
Probably, it depends on what stage you're in. Negative side effects are called digitalis toxicity. If digitalis builds up too much in your system, it becomes toxic. Okay, so in PT, we have to watch out for signs and symptoms of the toxicity. Signs and symptoms include cardiac arrhythmias, GI distress, dizziness, and blurred vision. The board loves to ask questions about digitalis toxicity. Oh, sorry, it's separate. These happen anyway. Sorry. These are the more severe ones if it fills up enough. Confusion, irregular pulse, we already said arrhythmias, lack of appetite, nausea, vomiting, heart palpitations, vision changes, orthopnea, and decreased consciousness. So the biggest ones they like to ask about are the decreased consciousness and the confusion and the palpitations. Okay, so if the patient starts to develop any of those, it's a sign of toxicity. It's an emergency situation. Contact the PT and the physician.
But you'd have to put your hand on their chest to feel the palpitations, no?
Well, you're gonna be checking their vitals first thing when you come in the room anyway.
True.
And then you come in and one day they were A&O times 4 and today they're A&O times 2. Not a good sign. And they're throwing up. Okay, digitalis toxicity. Know it back and forth. And side to side. Anti-clotting and thrombolytic drugs. So first we have anticoagulants such as heparin, warfarin, and coumadin. These inhibit platelet aggregation, therefore inhibiting thrombus formation. They stop the platelets from loitering in one place and forming again. So, almost anyone post-surgery, especially if something foreign is placed inside their body, like a joint replacement or maybe a heart valve replacement, will be put on an anticoagulant. If someone has had the cabbage surgery, they will be put on an anticoagulant. They may be put on these if they have atrial fibrillation. We talked about this earlier. Why is someone at increased risk of thrombus formation when they have atrial fibrillation? The blood is not moving smoothly. So anyone at risk of a DVT will be put on an anticoagulant. So what's our biggest negative side effect and risk if someone has decreased platelet aggregation? Excessive bleeding. Negative side effects, hemorrhage and GI distress if administered orally. Some of these are administered by IV. But hemorrhage is our biggest risk, which means don't let the patient fall and work on fall prevention. And careful while handling them because they will bruise easily. Okay, antithrombotic or antiplatelet agents such as aspirin and Plavix. Plavix. So, these are less, I guess you could say, potent, not as strong as the anticoagulants, but they really do the same thing. They inhibit platelet aggregation and clot formation. You'll see a lot of adults over 65 are just put on a daily dose of baby aspirin just to decrease their risk of developing clot. So it's indicated post-MI, atrial fibrillation, and again, preventing DVTs. So increased risk of hemorrhage, GI distress, and then potential for liver toxicity if it builds up too much. This just means lack of clotting. So again, don't let the patient fall, and increased risk of bruising. Thrombolytic agents. Anyone know what lysis means? To cut. Okay, so these cut up thrombi, such as urokinase and activase, ASE, thrombolytic, converts this to this, which dissolves. Okay, ACE actually means it's an enzyme, so it converts enzymes to help break up the clot. It's indicated post-MI if someone has a pulmonary embolism, they've had an ischemic stroke, or if they have a thrombus anywhere. Breaks up clots. So a lot of times they will be put on an anti-clotting agent and a thrombolytic agent. So you want to break up the clot that you know already exists and decrease their risk of developing future clots. So same thing, we have the increased risk of hemorrhage, especially intracranial hemorrhage. Some patients have an allergic reaction and some develop cardiac arrhythmias. Don't let your patients fall. Anti-hyperlipidemia. What does that sound like?
High cholesterol.
High cholesterol drugs, such as Lipitor or Zocor. Most of them are considered statins. Know that. Statins. The statins have their own special form of risks. But They inhibit enzyme action in cholesterol synthesis. Therefore, they help to break down the bad cholesterol, which is LDL, decrease triglycerides, which are extra fats in the blood, and increase HDL, which is the good cholesterol. Okay, so they're indicated for hyperlipidemia, aka high cholesterol. Also, if anyone has atherosclerosis, anyone has diabetes, or if they have peripheral vascular disease, which could be of the venous system or the arterial system. Negative side effects are headache, GI distress, myalgia, and rash. What is myalgia? Muscle pain. So let's say you're treating a patient and they're reporting myalgias. You look and see if they're on a statin. That could be why. So PT encourage aerobic exercise to maximize the effects of the drug because aerobic exercise helps to decrease bad cholesterol and increase good cholesterol. So if they're on a statin, they should be educated on participating in aerobic exercise. And that is cardiovascular pharmacology. Thrilling, I know. But don't worry, it's not done. Okay, you guys want to hear more about drugs or try to memorize a whole bunch of numbers? Those are your two choices.
Oh.
Drugs.
Drugs.
Okay, let's do some more drugs.
No. Drugs.
Okay, this is respiratory pharmacology or pulmonary. Same thing, know the class of the drug, know the mechanism of action, know the indicated diagnoses, the common names, the relevance to PT, and last but not least, negative side effects.
4 through 5.
Yeah,
What I mentioned.
All those.
for pulmonary.
No, you did
Cardio.
cardio one.
Okay, here's
Might as
a
well
list.
download the other one while you're at it.
A whole bunch of drugs we're going to learn about. Okay, first, beta-2 adrenergic agonists.
Oh.
Okay, we have short-acting and long-acting. Short-acting, the majority are administered by inhalation, because remember these are pulmonary drugs. And we have albuterol and levobuterol. Long-acting, we have formoterol, so if it's an all. So it's an agonist, so they stimulate these beta-2 receptors, which stimulates the sympathetic nervous system. That's the important part, which results in vasodilation of the bronchi. Okay, so they stimulate the sympathetic nervous system, which results in vasodilation of the bronchi. So both asthma and COPD patients can benefit from these. If they are short-acting, it's more of the emergency inhaler. So both asthma and COPD patients may have a short-acting acute emergency inhaler. The negative side effects is because it's stimulating the sympathetic nervous system, we may have tachycardia, palpitations, and tremors, as well as bronchial spasm. Relevance to PT, make sure you know the location of the patient's emergency inhaler so you can hand it to them if they need it. Okay, anticholinergic drugs are bronchodilators such as Atrovent, Apovent, Aerovent, Therovent. They all have vent in the title. They are also stimulators that result in bronchial smooth muscle relaxation, or there's some that work a little bit different and block the receptors that trigger bronchoconstriction. So they're either limiting the constriction or promoting the smooth muscle relaxation. So they are indicated for asthma and COPD again. Negative side effects are bronchospasm, dry mouth, GI distress, chest pain, palpitation, tremor, and nervousness. Again, because they are stimulators. Now these are more long-term than the beta-2 agonists. And the patient should be educated to use these inhalers before exercise. If you start to see the negative side effects related to the cardiac or visual system, it means they have toxicity. That would be an emergency medical situation. Okay, corticosteroids. What's the number one risk?
Osteoporosis.
Osteoporosis after prolonged use. Now, inhaled ones are less likely to cause osteoporosis because they're not administered systemically. But if used too often over time, it can cause lung tissue breakdown because that's where you're administering the steroid. So examples are Pulmicort, Symbicort, Aerobid, Flovent, Flonase, Advair. All of them inhibit the production of inflammatory cells, suppress the release of inflammatory mediators, and reverse capillary permeability. So they are anti-inflammatory. They are indicated for anyone who has bronchospasm, including asthma. Like I said, the negative side effect is tissue breakdown. Okay, so if they're on a non-inhaled, a systemic corticosteroid, you have the increased risk of osteoporosis. If it's inhaled, you have the increased risk of nasal irritation, nasal dryness, nasal bleeding, sneezing, cough, GI distress, and liver dysfunction.